Good morning, and thank you all for taking your time to be part of this webinar, which is being hosted by the University of Zimbabwe Department of Laboratory Diagnostic and Investigative Sciences, Cape Peninsula University of Technology, Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Pretoria Department of Chemical Pathology, in collaboration with Africa Federation of Clinical Chemistry and Laboratory Medicine, and Empower School of Health, who is our partner in the hosting of the webinar. They do assist with the logistics, hosting us, and also the registration and also the advertisement. And I would want to thank you all, especially to the you, the participants. You are the reason why we always come back and take our time to share with one another in the African continent on issues which are pertinent to us in the laboratory. And we do this to ensure that we are able to have a standardized way of practice in the lab and help one another to improve how we practice. And we know the issues that we face in the African continent are almost similar. No wonder why the reason why this consortium, the African Consortium of Lab System Strengthening, works together with all of us in the African continent, and also bringing in our colleagues from the diaspora to have their input as well, because they have had a chance to have a feel of what we are doing in the African continent, and also a chance to feel of what is happening in the diaspora. We can also infuse and help each other, strengthening how we practice laboratory medicine in Africa. We would want to indicate that I'm grateful for Dr. Witness Dobo and Prof. Shepard Maengano, who are joining us from the diaspora, part of the Africans who are working in the diaspora, but they can also have an input in how we are practicing lab medicine in Africa. So today they are part of the discussion, and we will be able to infuse what we are doing in Africa with what's happening in the global world. And today's topic being ethics in the medical laboratory. We do look forward to learning together, and you see that in the first part we have taken note of your comments that we need to ensure that we spend more time on the topic that we are discussing. So we'll have one presentation from Dr. Witness Dobo. Then we'll have more time with the panelists also having an input, and then all of us also have a chance to participate in the question and answer session. So feel free to post your comments during the discussions, and you also have a chance to ask or have an input during the panel discussion. Without taking much of your time, I just want to say thank you, and we look forward to learning together. I hand over to our facilitator, Chakando, and also to alert to him that Giza Chao has joined us, who will have a time to do some introductions. Thank you very much. Over to you, Chaka. Thank you.
Thanks very much, Dr. Machimura and the team, and everyone who is participating. As you have highlighted, this is part of our regular webinar, which we have, which we urge everyone who is attending for the first time to be part of this program. The main aim, as he has highlighted, is for us to empower one another when it comes to medical laboratory medicine. So of which the program for today, as it has been highlighted, I will be handling it, and then my name is Chakando. I'm the quality coordinator in South Africa in one of the academic hospital, which is Steve Biko. I'm not alone. I have a team, which I'm so happy to find myself being amongst these great men and women who took time. I know Dr. Mangano, where he is at night, they need to rest, but for the sake of this webinar, they saw it fit that we have to be part of this seminar. So what is going to happen amongst us, we have our Dr. Gazichao, who has to give us an intro for those, as I indicated, those who are attending for the first time. Dr. Gazichao Tadesse Akalau is the lecturer at St. Paul Hospital Millennium Medical in Ethiopia, Addis Ababa. He's executive board member of AFCC. He will be just giving us a hint or an introduction of the program for today as to what will be happening going forward. Dr. Gazichao, the time is yours. Thank you.
Thank you, Chakando, and all young and old presenters and invited speakers. And I think this program has been started at the end of 2020, and we're able to maintain really giving webinar and trainings across the globe. So lots of topics have been touched on supply chain, on medical laboratory week, and all other pertinent issues. I want to share my slide. I have one slide really to say a few things about the ethics. So today's webinar is, I think, on ethics in laboratory medicine. We need to really raise an important question why we want to really talk on laboratory ethics. We know that ethics in laboratory practice is a critical aspect of the scientific research, as well as it involves the moral principles and values. So quality usually requires ethical practice, and the ethical practice also supports what is coming out from laboratories that can really positively influence the patient result. So by quality in laboratory, we mean that the integrity and honesty and compliance with the regulation, avoiding conflict of interest, where we need to curious about confidentiality, following the safety protocols, and so on. I think all presenters will really touch all important aspects. My part is just to give you this program will continue dealing with on such important topics. As you know, we are just in Africa. So most of the African laboratory professionals are shouldering laboratory practice even without sufficient resources. So patients and stakeholders expect quality lab result and ethical practice even when there is no such access to sufficient medical laboratory disposables. So I think in the future, we will really touch important aspects of laboratory scopes and to bring change with regard to quality, safety, and so on. In the future, I can pledge you that FCC is part of the International Federation of Clinical Chemistry and Laboratory Medicine, so that AFCC represents, it's a federation, a continental federation that represents the region. So we will really raise sufficient topics in laboratory medicine. And very recently, in April, we will really also present and talk on a laboratory week, so that these laboratories are advocated, very recently advocated by professionals everywhere in the globe. So I think I wanted to really thank the Import School of Public Health, the ZAC, the IFCC, and the FCC, and I wish we will have a good deliberation in this webinar, and thank you.
Thanks very much, Dr. Gizichao. As always, I think it is a privilege to have you amongst us whenever we have this webinar. So colleagues, I will have to also indicate the program, because I know most of you, or if not almost all of us, we need to adhere to time. We have only an hour and 30 minutes for the whole sessions, as it has been indicated on our posters. So what is going to happen, we will have our presenter with Dr. Zobo, and then we will also, after that, have our roundtable discussions, where you will be feeling free to ask questions relevant to the topics which we will be focusing on. So I will urge everyone who is amongst us here to listen attentively to Dr. Zobo, and then after which we will have a closure. Let me introduce the team which I have here who will be participating on this webinar. We have our key presenter, who is Dr. Witness Zobo, who is a biomedical scientist from the Royal Devon University. He's also the member of the NHS Foundation Trust. His CV, so to say, if you look at his profile, colleagues, he is one of those who we feel so honored to be with us, from his experience, where he have worked in most African states, as a volunteer with the University of Sierra Leone, where he was dealing with the Ebola crisis as one of the deployee in Sierra Leone. He was also responsible for the diagnosis of the same Ebola virus, and was awarded a medal for bravery by the late Queen Elizabeth II. You can see that we have an icon, a champion, when it comes to a medical laboratory field. And then we also have our anchor, whom we won't have to forget, which is Sonia, who is hosting us as such from the other side of the other continent in India, whom we are also thankful for Sonia to be with us. We have Dr. Ian Machingura, who always urge us to say, can we have this? When are we going to have? Ian Machingura is the chairperson of the program, and then is the part of the University of Zimbabwe, as well as the chair. And then the other part which is also involved is as part of the African Consortium of Laboratory System and Strengthening and Public Health in Africa, the consortium, as well as which his position is the chairpersonship as well for that. We also have Prof. Maingano. Prof. Shepard Maingano is an associate professor of hematology and clinical chemistry and director of the medical laboratory technician program in the University of Hawaii, Scapulian Community College. He is also an adjacent professor in the University of Hawaii, St. John Burns School of Medicine. We also have amongst us, whom I know he will join later on because he's also attending another program is Prof. Erasmus, who is the former president of AFCC and serve as on the IFCC task force on COVID-19, public relation thereof of the same program, the point of care testing of which the program of this POCT is where he's currently also attending the program, but he will have time to be with us. He's also the editor of the African Journal of Laboratory Medicine, which Prof. Erasmus as well, we are so thankful to for you to join us or to be with us. And then we also have our Dr. Bettina Matsao, who is a senior lecturer in chemical pathologist in the University of Pretoria, as well as part of the National Health Laboratory Services in South Africa. Already we have highlighted Dr. Giza Chow, whom I have already introduced as such. So thanks, colleagues. Those are the people who will be part of the panel discussions, but there will be other people who as well, if the questions are well understood or need clearance, who will also join us. However, the panel discussion or the panelists we have are those Dr. Giza Chow, Dr. Matsao, Prof. Erasmus, Dr. Machingura, and Prof. Maingano. So without waste of time, I will go straight to Dr. Zobo, who will be giving us 40 minutes of his time to just give us a hint of the topic for the day. Thanks, Dr. Zobo, the time is yours.
Oh, thank you. First of all, can you hear me? That's quite important to hear. Can you hear me?
Yes.
Oh, thank you. Thank you. Thank you very much, Chaka, for the introduction, and thank you everyone who is on this platform and those panelists who are going to discuss this important topic. Yes, my name is Witness Zobo. I am working at the Royal Devon University Healthcare NHS Foundation Trust, that is in the southwest of England. I just wanted to start with by giving you a brief introduction of myself. I think it will be very helpful because of the topic that we are going to talk about today. My experience in well-resourced environment and less resourced environment, looking at ethics in the medical laboratory. So basically, I was trained at the University of Zimbabwe. I did attachments at one of the two large hospitals in Zimbabwe, which is Harare Hospital and Parinyatwa Hospital. Then when I finished my first training, I was sent out to a district hospital. This is a same rural area where I was working. And you can imagine the resources that were there for us to use. Then from the district hospital, I was then seconded again to a provincial hospital in the same province. Then went back to Harare, worked at Harare Hospital, then worked at Parinyatwa Hospital, then moved over to the United Kingdom in 2003, being employed by the University Hospital Southampton for 20 years. So I was there for 20 years. I briefly also worked at St. George's Hospital in London, and also briefly worked at a private hospital in Dorset, Winterbourne Private Hospital. And I was fortunate to be one of those people who volunteered as well to go to Sierra Leone in 2015 due to the outbreak of the Ebola pandemic. And we were working at a place, at a makeshift hospital. You can imagine what we were facing there. And it's my privilege and honor to be afforded this opportunity to talk on ethics in laboratory. Yeah, I'm not an expert here. There are many experts among us, people who deal with these issues, who are on the panel, and those people on this platform today who actually have contributed to writing the guidelines, the policies. I'm just here as a mouthpiece. So this is a discussion for all of us. And every comment, every contribution is welcome. Thank you. Right, it appears it does want to move to the right. Right. Thank you. So what am I going to talk about today? So we're going to define what is ethics. We are also going to look at the ethics challenges in laboratory medicine. We are also going to look at the evolution of ethics, as well as looking at the policies and guidelines of ethics. And we're also going to look at the ethical considerations of ISO, AAC, and IFCC. We're also going to look at the core principles of ethics, and then ethical issues in the medical laboratory. Then we're going to look at the application of the three principles of ethics. Since we are dealing with the lab, the ethics in the pre-analytical, the analytical phase, and the post-analytical, then we conclude, then we have the time for discussions and questions. So basically, what is ethics? So, right. The word ethics is actually derived from a Greek word, which is ethos, which means the way of living. So ethics is a branch of philosophy that is concerned with human conduct, more especially the behavior of individuals in the society. And therefore, the field of ethics involves a set of principles of right conduct. So when you hear the word ethics, there are quite a lot of issues that come into context, which is integrity, moral values, honor, right, fairness, responsibilities, the choices that we make, the principles that we have. And now, we now have a branch which is called bioethics, which is now relevant to the field that we are going to talk about. And how do we define it? Bioethics is a branch of applied ethics that studies the philosophical, social, and legal issues arising in medicine and life sciences. Now, the lab medicine and biomedical research, like all other areas of medicine, are required to adhere to high ethical standards. The lab medicine and the biomedical research are actually interconnected by laboratory testing. But for today, we're going to focus on the lab medicine. There are a few ethical challenges, few or many ethical challenges that we face in every setting of a medical lab. The ethical challenges that we face are the patient results or the participant results and the patient samples, i.e. whether it is blood or tissues, and what do we do with the remaining patient samples or the blood samples. Also, the issue of genetic testing. The other issue, ethical challenge that we have, I'm sure the previous speaker who gave it was talking about this, consent, confidentiality, cause of conduct, proficiency, conflict of interest, and direct access to testing. As people who work in the lab, the laboratory staff's behavior, etiquette, and actions should be in a professional way. For example, if you work in the lab to maintain the ethics of the lab, there are certain things that we should do as the lab staff. i.e. we should put on proper and adequate PPE. For example, if you're in the lab, you are supposed to wear lab coats, gloves. And another question that rises, do we have a dress code? No, I don't think we've got a dress code, but what is ethical is for one to be dressed up properly. People have to believe the work that you are doing to say, right, this is a lab scientist. And if they say they've given you a result, people have to believe you by the way you are dressed. If you are dressed in a certain way, people won't believe that. So it is highly recommended that we should be dressed up properly as scientists who work in the lab or a staff who work in the lab. I remember very well, this is quite interesting. When we started our first lecture at the University of Zimbabwe, one of our lecturers, because we were coming from high school and we were all dressed in this fashion, you know, when we were young boys coming from A levels and we wanted to show off, and we had our first stipends, and we bought these basketball caps, we bought these baggy jeans, these tracksuits, and we got into the class. And the first question that the lecturer asked said, okay, he made one of us to stand up and he said, okay, you want to train as a scientist? And said, okay, if you are dressed like that and someone walks in the lab in which you are working, do you think the person is going to trust the results that you're going to give to them? From that moment, I think from that day, it really changed my perspective of dressing in the lab. And I want to say, the way I dress in the lab from the first day I worked in up to now has not changed. I make sure I am well dressed up. As you are seeing me right now, this is how I'm always dressed up. When I get into the lab, I take off the jacket and put on the lab coat and work as a proper professional. So these are some of the things that we need to observe if we are working the lab. And also, the other things is about our phones. Now, the issue of mobile phones. Do we switch off our mobile phones? Do we turn them off? Are they on silent when we are working with patient samples? And also the other issue, the challenge is we are not supposed to be discussing any report with the clients and others. You know, as a scientist, you are not supposed to be found discussing about the results or lab report results, or even discussing it with the patient. And the challenge that I've spoken about here, they're actually more prevalent in resource-limited settings. I have worked in both environments, and I'm talking from the point of experience, the things that we have seen. Then, of course, there are codes of ethics that needs to be adhered to. So the professional personnel of medical laboratory are bound by ethical codes of their respective profession. So there are ethical codes which bind us, and we need to observe them. So a code of ethics may be described as an expression of basic values, the principles and standards by which we should conduct ourselves. And it is quite important and prevalent that several laboratory professional societies and organizations have developed this codes of ethics with common principles of conduct which act as guidelines to professional members of those organizations. All right, quite important here. We just want to look at the evolution of ethics, right? The first code, which is called the Nuremberg, was in 1947, was set up in 1947. This was drafted in 1947, and it's actually was the genesis of medical ethics. There was no code governing the conduct of human research before the World War II. That's quite surprising, and you know how people would behave if there was no code of conduct. So this one was the first one. So it outlines the need for participants: one, consent; second, qualified personnel, and also it sets a criteria for halting research which are not proper. Set the criteria for halting or stopping experiments. And this code has got 10 principles, which we're not going to talk about. Maybe they will be discussed later. Then in 1948, there was the Declaration of Geneva. This was drafted shortly after the Nuremberg Code. And it was just a physician's oath. So the Nuremberg Code was a set of ethical principles for human research, but the Declaration of Geneva was just the physician's oath. And in 1964, we have the Declaration of Helsinki, which was then revised in 1983, 1989, 1996, 2000, 2008, and recently 2013. It is formed from 10 principles of the Nuremberg and the Declaration of Geneva. So the Nuremberg Code and the Geneva Declaration were combined together, and it was put together by the World Medical Association. And it has several revisions, as I have already said. It is regarded as the foundation of human ethics. It indicates that the well-being of the patient is more important. The well-being of the patient prevails over the interests of science and society. That is quite critical. It also prescribes the need for written consent, meaning to say, you cannot just do a research, or you cannot just take sample from someone without the consent of that person. That person has to sign. And also, it also prescribes an oversight by an independent committee. Right. Then in 1978, 79 comes the most important one, which is the Bellman Report. This was put together by the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research in 1978. This one is very important because it outlines the 3 core principles in health research, which we are going to talk about. The 3 principles are the respect for persons, beneficence, and justice. We're going to see this in the coming slides. We're going to dwell a little bit more on this one. And what is important about this one was this was actually this came about after the Tuskegee study. I'm sure some of us will know about the Tuskegee study, which was from 1932 to 1972. The purpose of this study was to observe the effects of syphilis when untreated in African Americans. And I think the number could be, it could be rectified or corrected. I think it was about 400 men, African men with syphilis were recruited. Unfortunately, the men were not informed of the nature of the experiment. And this was actually done, this study was done by the United States Public Health and the CDC. And the unfortunate point that some men died from this study, and actually it was recognized that the disease, when the study finished, it could be treated. This was quite an unfortunate, and you can see why then we need to have these codes of ethics in place to prevent such instances which took place. And then we have got the that is 1992 to 1993. We have the Council for International Organization Medical Services. This was developed. This council developed international guidelines for epidemiological studies. The guidelines also revised in 2002. This one actually mostly focuses on pharmacovigilance and also the reporting of drug effects. And it also prescribed the protection of research participants. Right, that's basically, that was the evolution of the ethics that we are talking about. So the question that we may have is, do we need lab ethics, medical lab ethics? And the answer is yes. From what we have just indicated, things that we need to take care of, we definitely need med laboratory ethics. They are quite important to prevent unfortunate ends. So the policies and guidelines to ethical issues. So ethics as it is, it plays a very significant role in laboratory medicine. The knowledge of ethics helps us to protect confidence, operational integrity, capability, impartiality, and safety of staff. So for this reason, many countries and their profession societies, they have developed policies and guidance material regarding ethical issues in lab medicine. So every country, no matter it is from the less resourced area, we need to have this in place. And interestingly as well, the International Federation of Clinical Chemistry, IFCC, the American Association of Clinical Chemistry, AACC, and the International Organization for Standardization have defined ethical recommendations for clinical laboratories. So for any lab in the world, there are some guidelines, there are some recommendations that we can take in and put into practice in our laboratories. Now, if we just want to look at the ethical consideration in ISO, we know most of the labs, and this is an international standard. Most of the labs, more so from where I'm working from, almost every lab is accredited according to ISO 15189-2012. You will find almost every test in the lab is accredited on this standard. And if this, in the United Kingdom, for example, we've got the UCAS accreditation board that looks after every lab in the United Kingdom. If a test is not accredited, you cannot just give it to the patient or to the clinician. You have to indicate, if it is not accredited according to this standard, it has to be indicated. So the section part of this document from the ISO 15189-2012 summarizes the ethical conduct expected in laboratories. The document states that laboratories should have in place means to ensure that there is no involvement in any activities that will diminish confidence in the laboratory's competence, impartiality, judgment, and operational integrity. You see, these words that are keeping on coming. The competence, the impartiality, the judgment, and operational integrity. And also, quite importantly, the management and the personnel are free from undue commercial, financial, or other pressure and influences that may adversely affect the quality of work. What is happening now, and how this consideration is quite important. What is happening now? Most labs from this side, they are actually working on what is called managed service contracts. You have got big companies that come together and they say, we're going to offer you these machines, and these machines we're going to offer you for free, and what you're just going to do is you're just going to buy the reagents from us, and they come and maintain your machines and do everything. But these are very big companies and very successful, powerful financially. And what this statement said, or what this consideration said, it says the management personnel should be free from undue commercial pressure, because you want to protect the quality of work in the lab that you work. I have been involved in one of these, because they come and bid, and the way they present their bids is amazing. But as the management and personnel of certain lab, it is highly recommended that we should not be under pressure or influenced by these big companies. Still continuing on this one, where potential conflicts in competing interests, they shall be openly and appropriately declared. So sometimes there are what we call conflicts of interest. We know there are individuals who are working for a lab, or they are involved in lab work, or they have got their own, but there's this conflict of interest should be openly declared, so that there is a proper flow of the work that needs to be done. Because what we need to do, what we need to remember here, what we are doing it for the patient, and the patient should always come first. You know, even if you are writing a research report or a paper to publish, you have to declare your interest. It's quite important. So this consideration is also encouraging people in the lab as an ethical issue, that you should always declare your conflict of interest. That there are appropriate procedures to ensure that staff treat human samples, tissues, or remains according to relevant legal requirements. There should be a protocol for each lab. How do you dispose? Like I have mentioned earlier, the ethical issues that we've got issues of samples. You should have a proper protocol, a document, an SOP, which actually tells the staff how do we dispose certain samples or certain tissues in the laboratory. And also, confidentiality of information should be highly maintained. Then we come to the AACC. It actually talks about the uphold standards of professionalism. As people who work in the lab, to maintain our ethical, we should be honest in all professional endeavors. We should maintain a high level of personal integrity. We should avoid scientific and professional misconduct, including but not limited to fraud, fabrication, plagiarism, concealment, inappropriate omission of information, and making false or deceptive statements. We have read especially during the COVID time, how unethical some people were. We have read, and some people were put in jail. Some people were just writing or creating or selling out COVID reports, COVID certificates, because we knew for someone to move from point A to point B, they needed to have a COVID. But this happened. It's not something that is hidden. But we could see how we violated the ethics of the lab by just giving out reports, people not being tested. So from the AAC, they actually say this should be avoided. And also, report any healthcare profession who engages in fraud or deception, whose deficiency in character or competence jeopardize patient or patient care. It's quite important. It's quite important, but it's difficult when you see a certain individual behaving in a manner that does not conform or confine to the standards that are set for someone who is a laboratory scientist. Yeah, I remember at some point where I was working, one of the colleagues, when I was still in some place, one of the colleagues will actually get overdrunk, and the people will point to us and says, that's one of you. We had to drag him from the bridge. He was overdrunk and he was coming from, and it puts the profession into disrepute. So this is what the consideration is asking us. We should report, but I know it's very difficult for us to do that. But it is quite important that people with the deficiency in character, they actually jeopardize patient care or other personnel. Should maintain a high level of quality in the products of professional endeavors, including validity, reliability of test results, interpretive opinions, publications, scientific research. Another important aspect is continuously strive to augment the professional qualifications, knowledge, and skills, and present them accurately. Some people, when they attain the first qualification to work as a laboratory scientist, they say it's all, but we are encouraged that it is ethical that one should continuously strive to augment, do the CPDs, learn more, so that you have got the knowledge, you increase your qualification and skills, and once you have got that, present them accurately for the sake of the patient you are dealing with. We are encouraged again to promote the safety and welfare of patients, employees, co-workers, colleagues in public and the environment. We should also comply with relevant laws and seek to change when they are contrary to the best interest of a patient. Importantly, we should encourage open and honest discussion among physicians, other healthcare providers, and or facility managers regarding disclosure of patient of information about medical errors. This is quite critical and this is quite ethical. Sometimes an error is made in the lab. In the institutions that I've worked, there is a reporting system if an error has been made, and it should be discussed openly. But what is required is not to point fingers at someone else, but it should be discussed openly, it should be recorded, and then a preventative mechanism should be put in place so that we continue to protect the patient's well-being. We should never hide errors. We should never hide things that have gone wrong in the lab. If someone has done something in the lab, if wrong results are, it should be reported. It's not a matter of just deleting them or taking them off. If something of that kind should happen, it should always be reported. That's being ethical. Now, the IFCC, the International Federation of Clinical Chemistry, they have constituted a task force on ethics. So the task force actually rationalized the documents and spread the education and training of ethics. So it has actually created a toolkit which serves as a repository of documents developed worldwide in the kingdom of laboratory ethics. So what are the core principles? I've already mentioned them. The core principles of ethics are respect for persons, justice, and beneficence. So it's respect for persons, beneficence, and justice. And if you look at these three, they are actually centered on the patient. They are all about the patient or the participant. I remember at one trust that I worked, their mission statement was, or their vision was, patient first. So whatever you do, it has to be concentrated on the patient. They had three vision missions, but the most important was patient first. And when you go for an interview on this one, you have to make sure that you know about their vision or their mission, which is patient first. So you see, the core principles of ethics are centered on the patient because the patient is the most important person in this issue, right? So respect for persons, what is it? It's the acknowledgement of autonomy and protection of those with the diminished autonomy. There should be no interference with the decisions of competent adults. That's what we'll be looking at. We should respect human dignity. Each patient participant has freedom of decisions. The patient should be, we should acknowledge that the patient should choose, has got the freedom to make decisions. And also we should respect patients and participants. So that's respect for persons. Then beneficence, the duty to act in the best interest of patients or research subjects, the goal of maximizing benefits and minimizing harm, and also called non-maleficence. So it refers to our duties in the best interest of the patients or research participants. We should always make sure that all the protocols we have maximize benefits and minimize harms. Everyone must be fair and correct in all their actions and must take positive steps to prevent harm on patients or participants. Then justice is the duty or obligation to treat patients equally and to distribute by allocating fairly what is right due in terms of benefits, risk, and costs. All safety concerns must be met for a patient. We must not impose unfair burdens on patients or participants. All individuals shall have an opportunity to participate in research unless contradicted. An obligation to treat all people fairly and impartially. It is an obligation to provide all patients with whatever they deserve. So these are the three core principles of ethics that we need to observe in our labs. Right. So ethical issues in the medical laboratory. So the medical lab has got 3 phases. The first one is the pre-analytical, then the analytical, then the post-analytical. Right. What is involved in the ethical issues in pre-analytical? So there should be proper identification of the patient or subject. This is quite important. I know most of us do not do this work, but and we may have people who are nurses on this platform or pharmacists and everyone else. These people should be trained. It is ethical that they should have a proper identification of patient or subject. And when that sample comes in, we need to correlate that information. Are we dealing with the right sample from the right patient? Otherwise, we may send the wrong results to the wrong patient, which is not right. Collection of the appropriate sample using appropriate technique, appropriate identification labeling of sample so that the right tests are performed. This is quite also important. When the sample is taken, there should be an appropriate identification and labeling of the sample so that the right test is performed. Appropriate handling of samples of specimen until testing is performed, which is quite a big challenge in some areas where some places are very remote. And how are those samples, how are those samples transferred to the lab? It's quite an issue. It's quite an ethical issue, because by the time, if the sample is not preserved in the right manner, by the time it comes, the sample will have degraded and it gives a wrong result. So we understand that there are challenges. And I think in one article that was written by some panelists here, they actually mentioned that that is a challenge in places of remote. They have to send their samples into the city. And I remember when I was working in one of the outstation in the district hospital, we had to go to clinics in rural areas. And then by that time, those clinics, they don't have microscope. We had a pandemic of malaria. And I remember what we needed to do, because we wanted to do diagnosis quickly there. I had to use the sunlight microscope. That was my first time. We were used to the microscope in the lab, but because of the nature of what was happening, we were just trying to have results as soon as possible. So we would move from one clinic to another. And we had this sunlight microscope that we were using. We had our staining equipment with us. Then we would look at but what I'm just trying to say, I'm just trying to look at the ethical challenges that we have in some places, especially in less resourced areas. But we should try to make something out of those challenges that we have. Yeah, right. Right. Then how do we apply the 3 principles? So in respect, we make sure consent is regarded. The patient's right to refuse to be tested should be respected. Some patients can actually say, no, I don't want to be tested. That should be respected. Then beneficients, all tests should benefit the patient based on the best medical evidence. Specimen should be labeled with at least 3 unique identifiers. I know some people use 2, but it is critical that every single patient sample should have at least 3 unique identifiers. In the institution that we use, a sample can be taken in by 1. It has got your first name, your surname, and there's a unique identifying number, which is called either the NHS number, because every individual in this country has got an NHS number, or the hospital number. This is for general laboratories, but there are some areas like the blood transfusion are more restricted. They want about 6 points of identification. 1, what time was the sample taken? 2, date. 3, is there a signature on the sample? Those are quite important things. So this is done to benefit the patient. That is quite important, to benefit the patient. You have to make sure you are testing the right patient from the right sample from the right patient. Then justice, providing access to a wide variety of laboratory tests at reasonable cost. This is quite important. We know how cost affects testing, especially in places where we don't have insurances. Luckily, where I live, health is accessible by everyone. You don't pay for it, but to maintain the ethical of the lab, we should, if a lab is being operated, it should have a variety of laboratory tests at a reasonable cost so that every individual should be able to afford it. No preference given to individuals to facilitate or expedite the collection process at the expense of other patients. Quite important. When you work in some certain areas, maybe you work in a, like, I remember very well, giving an example of myself, I worked at a district hospital, and then people come in and they are waiting for their results. And sometimes your relative comes in, or the head of the department, whatever. The principle of justice indicates that there should be no preference given to individuals to facilitate or expedite. It doesn't matter, it's your relative, it's your boss, is a what, they should, all samples in the lab to maintain the ethics of the lab should be tested the same way. Then in the ethical issues in the analytical phase, confidentiality, quality, competence are vital for all laboratories and setting. Confidentiality during analytical phase may be almost a byproduct of automation. Luckily here, confidentiality, because most of the system is automated, the sample is just put in, you don't say. But in areas now where a small laboratories, this could be a challenge of confidentiality, because you can look at the sample and you know who it is from. But it is encouraged that during the analytical phase, confidentiality should be maintained. Applying this, so we can apply the three principles again. Respect, patient have the right to decline to have their specimen analyzed even after the specimen has been collected and processed. So you can receive a call and say that should be stopped, and it has to be, confidentiality should be respected and maintained, especially those who work in point of care. Special care should be taken to maintain confidentiality as much as possible. Beneficiaries, good laboratory practice should involve the establishment of rigorous quality assurance program. Let me repeat again, this is very ethical. Every lab should have a rigorous quality assurance program. What does it involve? It involves internal quality control, it involves internal quality assurance, and it involves external quality assurance. That's good laboratory practice. And once you have got this in place, they actually benefit the patient, because you know the results that you are producing are up to standard. Justice, all patients samples are to be treated equally. I've already mentioned that laboratories should develop appropriate operating procedure. So every sample that comes to the lab, you should have an operating procedures for start or prior testing, and state which tests are included. The procedure should actually state which tests are included and the expected turnaround time. Very critical, you should have turnaround time for every sample that comes in the lab. It's not a matter of, no, we'll test this one later, we'll see that one tomorrow. Every sample should have a turnaround time, and the turnaround time should go to the service users. Your patients, everyone else around you should know that if they send a blood glucose to the lab, it should take how many hours to come out. This should not be private, so that if someone is waiting for a result, they know. So that is justice. That is one principle that we should endeavor to achieve. Right, the post-analytical phase. So the post-analytical phase actually includes the reporting and interpretation of results, data access, residual, specimen storage. So the ethical issues in post-analytical phase, laboratories should have a policy for specimen storage and disposal. Quite important. This, we should have a procedure, a protocol, especially if you work with human tissues. For example, I'm just giving as an example. You work in molecular virology, where you want to test certain viruses through molecular procedures, and you get a tissue from histology because some virus lodge into the tissues, and they give you a piece of tissue. The virology lab has no protocols to keep those samples. What they should do, they should, after testing it, they should take it back from where they're, because it is only the, I'm just giving you some, it's only the histology department that has got the protocol, procedure, and the legality on how to dispose those samples. When you receive those kind of samples, as in lab medicine and from histology, you have no right to dispose a tissue sample unless if you have got a protocol of doing that. So this is what is being said here. You should have a policy of specimen storage and disposal. Where do you store processed samples? How do you dispose them? Archiving of results in either electronic and hard copy format is important aspect of good laboratory practice. You need to have your records archived. If you've got paperwork, make sure they are archived where they're accessed. If it is electronic, it's okay. And we know some records, they have to be archived or kept for more than 30 years. So you need to have proper places to do that. Those are the ethical issues that we have in post-analytical. How do you archive the documents, your request forms, your raw analytical and quality control data results and reports? In the environment that we're working, you have found out that we have some institutions have gotten rid of request forms now. Everything is done at the patient. The clinician will just request everything online and it comes to the lab. And this, when the sample comes in, you just want a barcode and it comes in. So you rarely see paperwork request forms in the lab in most laboratories in some areas in where we are working now. So it's quite important to actually observe these challenges. How do you report? We don't want to see people's records lying all over the place. So applying the 3 principles, again, confidentiality of results, patients have a reasonable expectation that their samples will be used solely for the laboratory testing requested by the clinician. Any further testing of residual samples should be approved by a local ethics committee or board, and patient consent may be required. So we still need to respect the patient. If there are any residual sample and you want to do further, you should seek ethics approval. And the ethics approval, especially where we work here, is a tight job. It's a very challenging job. You'll find so many people who are doing researches. It may take 6 months to get the approval. It may take a year because there are rigorous processes that one needs to go. Why are we doing this and why is this in place? Is just to protect or respect the patient who has donated the sample, or in preventing them from harm as well. Beneficence, quite important. Qualified personnel should interpret the reports. Misinterpretation of results causes patient harm. We know in some places there are people who are not qualified who phone out results, but if you talk about interpretation of results, they should be interpreted by a qualified person. An appropriate name for the test should be performed, an appropriate reference interval. So in our labs, we should have appropriate interval. When we say interval, we say what is the normal range or what is the reference range for glucose. You should state that in the report. The unit of measurement, is it measured in millimoles per liter? Is it in micrograms per liter? That is quite important. A designation that the test is within or above reference. So you should show the system that we use. If it is above or below, it indicates in red and it quickly attracts your attention to look at it. Should also turnaround time is quite important. Turnaround time should be as short as possible, but it should not compromise the validity of results. Justice, reporting of results should be consistent for all patients, rapid reporting whenever required in special cases. So what we have observed, I'm sure my time, I'm about to finish now. What we have observed in some institutions, justice in terms of reports, the patients should have their reports. What is happening now, when you finish with you have validated the report goes to the doctor, and then the doctor releases the results to the patient. So the system, or what is called the lab information management system that you have, is actually linked to the patient. The patient can go in there, log in, and can see all the results because the results are for those people. So we are just trying to look at how the 3 core principles are being applied, justice to the patient regarding their results. So in conclusion, it is necessary to incorporate the core principles and the guidelines of bioethics in the areas of medicine. Any laboratory involved in human participants should follow international standard and practice of ethics. Medical laboratories should uphold the reputation of their profession. it is required to develop an ethics policy and add it to the laboratory quality assurance. We also promote the development and implementation of ethics training program for your laboratory staff, highlighting human values and responsibility, honest in their work. This will surely initiate and encourage the change of paradigm with the aim of increasing knowledge, keeping in mind ethical principles in our daily laboratory procedures. Thank you.
Thanks very much, Dr. Zobo. That was a mouthful, quite informative. I think this is worth to attend for those who are participating. I think as one of our colleagues who's working with us, Vinita, indicated, just make sure that you ask questions where you couldn't get the info accordingly or where it was not cleared. That was quite informative, Dr. Zobo. Thanks very much. Because of time, we will have also a session for the questions, but I will allow our panelists to give some few take on the ethics from their personal experience. Hence, we have them amongst ourselves. I will start with the two profs whom we have before we get to the session of questions as well. I will start with Prof. Erasmus for 5 minutes. Anything which you think we could share on the principle of ethics, and then Prof. Maingano will follow thereafter. Prof. Erasmus.
He has stepped out briefly. You can end with him. I think he's coming back. Sorry about that.
Okay, no, thanks very much, Dr. Machingura. As I highlighted, Prof. Erasmus is also on another engagement. Prof. Maingano, can you just share from your personal experience when it comes to ethics, where you think it can be applied for 5 minutes? I just wanted, you know, they said we have to let it when still everyone is around. I don't want people to leave before we finish this or to wrap up. In 5 minutes of your time, is start now.
Okay, thank you again, Chaka, for giving me the platform. I'm Professor Maingano here. I'm right in the middle of the Pacific, so it's 10 o'clock our time. So I would like to acknowledge some of my colleagues who are still up. But anyway, getting to it, I think Dr. Zobo has covered pretty much everything there. I just wanted to add maybe one or two things that are of importance. And one of the things I wanted to mention is when he talked about errors in the laboratory. Because actually, according to research, clerical errors are the #1 errors that in the lab, especially in less resourced laboratories where everything is written, right? On my side, right, based here in the United States, most of our labs really use the laboratory management system, the computer system. So we find that whenever there's a problem with information, when information is entered, and usually that's where the errors are going to happen, especially with the way we name things, we name people today, right? The juniors, the middle initials, and that's where we find the errors. So the computer system, the laboratory management information system helps us really to catch those errors, right? So that's, I just wanted to kind of highlight that because it is important. And the other thing I wanted to also to add to what you said, in addition to the those organizations, the Nuremberg Code of 1947, and the Helsinki and the Geneva and the Beaumont Report. So on this side in the United States, there's also another rule that was added. I think it was 1981, which is called the Common Rule. So the Common Rule incorporates all these other documentation that was created, the Nuremberg, the Geneva, and so forth. So the common rule was developed in the United States and for all government-funded research, right? And the idea is kind of highlights two important scenarios. One, it is to ensure compliance. So that means requirements for researchers obtaining and documenting informed consent. That means that whenever we are working with patients or volunteers, informed consent must be in the forefront to make sure that those patients or our subjects are aware of what they are going to be participating in, and they can make a decision whether they should participate or not. And also requirements for the Institutional Review Board, the IRB. So the IRB, for some of you, just refers to a group of people who decide if you can do a research, let's say, on a particular group of people. So this common rule states that it wants the IRB to be composed of a certain group of people, right? Different expertise. What is the membership? What is the function of this group? What are the operations? And again, the record keeping. So it looks at that. At the same time, another important aspect of this common rule is also protection of certain individuals who are vulnerable. And as he said, prior to the World War II, right, certain research or individuals were involved in this research without really accepting it, right, because they were not told or they were not aware of how those participating in those research studies would affect them. So in this case, especially in the United States, there are certain groups of people who are protected. So when you are doing an IRB, right, there is what's called a full IRB. This means that they are going to look into this group a lot closer than they do with other groups. So that involves pregnant women, something like in vitro fertilization. If a research is involving fetuses, if it's involving children, especially if you have everybody under 18 or prisoners. So because those are vulnerable groups that can potential to be abused. So in addition to common rule, the laboratories themselves also got together and they developed what we call the ASCLS, which is the American Society for Clinical Laboratory Science. This was formed in 1933. So in addition, or maybe it's just a segue to what Dr. Zobo said, there are three things that this organization focuses on. That's one, duty to the patient. Is a duty to the patient. That means that, one, we must make sure that the labs that we are operating are of high quality. To be of high quality, they must be safe, they must be effective, efficient, timely, equitable, as well as patient-centered. So that's our duty to the patient. And it's an idea of putting the patient's needs ahead of ours, right? And at the same time, we want to make sure these patients are treated, or maybe these patients, we take their specimens, we work with the samples without regard to their disease state, to their ethnicity, race, religion, or even sexual orientation. That's our duty to the patient. So when I'm in the lab, the idea is that I have to look at the patient, not who the patient is, right? So if you can see what I'm saying. The second aspect of it is duty to colleagues and profession. That means you and I, as laboratorians, we are each other's customer, right? I have a duty to make your life easier. So to do that, I must uphold dignity, right? And honesty, integrity, competence, and reliability. That way, when we are working side by side, we are able to produce our results that are of high quality. And the last part is duty to the society, because we serve a community. We cannot be separated from the community. So we serve as patients' advocates, okay? We apply expertise to improve patients' healthcare outcomes by eliminating barriers. So Dr. Zobo mentioned about, what's the term he used, which is let me kind of find out, kind of escaped my mind right now, right? It's the beneficence. Beneficence, that's why I'm looking at. So what is really beneficence? And he's talking about beneficence, meaning that we have to do what is good, a deed that is good, right? And again, non-maleficence, meaning that do no harm. So when we are guided by those guidelines, it makes us produce high quality results, because the whole idea is to make the patient heal, right? That's all our goal, to make the patient heal. So the ASCLS is one of those. And I think the last one I just wanted to mention is also some of the challenges that we see in the lab, right? So the challenges, as we said, there are two areas here that we have, actually three areas we think about. There's research, there's working in a well-resourced laboratory, and there's also working in a less resourced laboratory. So sometimes there is this issue of how do we balance those three, right? And we use these guidelines, in ethical guidelines, to really focus and be able to produce our results. And at the end of the day, one, for diagnosis, disease management, as well as just being members of the community. I think my 5 minutes is up. Thank you, Chaga. Appreciate that.
Thanks very much.
Yeah.
Thanks, Prof. Thanks very much. I think, Dr. Machingura, we have to expand this next time, and then we get some of our experts on this subject to be expanded, because it's one of the critical parts in our professions which we need to look at. Thanks very much, Prof. Mangano. Dr. Machingura, if within 2-3 minutes from your own experience, then Dr. Matsao, and then we'll end up with Dr. Gizajao.
Thank you. I thank you very much. I think that was an elaborate discussion from Dr. Zobo, and also the input from Prof. Mangano. My input would be in line of to say, in Africa, issues that are particular for us is the resource constraints. And I think it's one critical issue that we need to be, as laboratorians, to maximize the resources that we have. It's ethical to be using the resource to the best of our ability, in order not to unduly be influenced per se in purchasing which is beyond what is relevant, and affecting the access for the resource to others who need to have access to the testing. I think it's one of the most critical issues which we need to pay attention to in terms of in Africa, in terms of resources. And another issue is pertaining to the performance of the test according to the highest standard, to ensure that the result that the patient gets is relevant, is the most appropriate for the patient. And really, we do not want the testing which doesn't result in a result that allows to be of clinical use, because one, the resources are constrained, and two, the patient will be looking up to us as laboratory professionals to be doing the best of what we can in the scenario, the trust that they have for us as professionals. So we owe it to the patient to deliver as laboratorians in Africa. And the other issue that I also think is of also concern with the influx of genetic testing, what it is now revealing, sometimes some things that are found during the genetic testing for clinical or for research, it may not have an impact only on the patient that you are dealing with. And these are some ethical issues that we'll still have to grapple with as more and more genetic testing is becoming available in Africa. And in conclusion, I just want to say, we owe it to our patients to do the best and to uphold the highest ethical standards, and also to ensure that we develop the next generation of scientists or laboratory professionals, both the clinical and the medical laboratory scientists and the technologists, as some may call them, in the lab. Thank you very much, Chuck. Thank you.
Thanks very much, Dr. Machingura. Dr. Matsau, from your part.
Thank you very much, Chaka, and really thank you, Dr. Zobo, for this comprehensive presentation you just gave. And I just want to start by saying ethics is a cornerstone of the work we do in laboratory medicine. And as I was listening to Dr. Zobo, you literally, as a chemical pathologist and literally being responsible for interpreting the results of the doctors and sometimes even informing them where we have committed error, it's actually scary that we only look at ethics. Well, I want to say sometimes. This should be something that we do consistently. And I want to agree with you, Chaka, that this kind of discussion must actually be consistent so that we're always aware. One of the things that he mentioned was that what do we do with a cell phone? And no one really knows, because when we come from the old school of thought, where during our training times as scientists, there were no cell phones. So the phone is there and someone is going to run to the phone. Today, everyone has a cell phone. And it is difficult to say no one should actually have access to their cell phone because there could be an emergency. We have so many people in the lab. You can't say if your family call, they should call the main lab office, the lab manager's office, and I will attend to you. So this is actually very difficult. But the example that I want to look into, and I'm glad that Prof mentioned lab errors, because Chaka, as you know, we live in lab errors. We have so many, especially now with the issues that we are dealing with, whereby sometimes we don't have reagents and the sample may actually be there for a while. When you look into the issues of justice, for example, and we want to treat all these patients equally, regardless of their stance, what do we do in a situation where you run out of reagents? You can't refill all your tests. Sometimes the supplier tells you that, oh, you know what, don't worry, the shipment is on their way. You'll have your reagent by this afternoon. And we know that sometimes that shipment doesn't arrive. And then you would have this one doctor who will say, this specimen, this patient results are urgent. Please help me. It's tempting to send these results, the sample to a neighboring lab. It can be a private lab. But then looking into the fact that all these requests that we have are equally important. The fact that patient Dr. A did not call me, but Dr. B called me, doesn't mean that the results of that patient of Dr. A are less important. So we are consistently challenged in public service by these issues. And also, one other thing that you mentioned was communicating results to our clients. Now, we only discuss this, obviously, with doctors. Our patients and public service do not really communicate directly with us. But public service doctors rotate. So you have the doctor who requested the test, and another doctor who took over the patient management calls you and asking for the results of that other doctor. You are literally duty bound to discuss these results with this doctor because you want to save the patient. But in terms of ethics, there's somewhere where there's a bit of a gray ground. So, I mean, when it comes to ethics, we can speak forever regarding the issues where we are still tested regarding how do we deal with this particular situation. The last aspect I just want to mention, and because Prof. Mangano mentioned the reference intervals, I just want to throw it to every one of you that you do realize that we use reference intervals, and most of us, when the machine arrives, we use the reference interval from the manufacturer, and we are able to calculate the new reference intervals. But there are various subset of communities that we are still unable to help. And that's simply because those reference intervals do not exist. The example I want to put out to you is the member of the LGBTQI community. Now, these groups, to this day, we do not have any reference intervals for these people. We lump them, we decide for them where they should fall in. And in terms of ethics, this is actually incorrect because patients should be classified accordingly. We should give people results that we ourselves can trust. Reference intervals in the state are a bit of a challenge. Another group are the children. Another group are pregnant women. We don't have specific reference intervals for pregnant women. And we know that a sample from a pregnant woman, especially in advanced pregnancy, because pregnancy is a hypervolemic state, we know that the creatinine in that lady is very different for her pre-pregnant state. But we decide to use the pre-pregnant state, but that is actually not correct. So it's really ongoing. And I just want to stop here and appreciate everyone's contribution. And indeed, I support the notion that we should revisit ethics quite often because we really have many things that we can help each other to learn and to improve on. Thank you for the opportunity.
Thanks, Dr. Matsao. You mentioned a lot of things which are quite interesting and intriguing. I think the learned friends will also look at this, the reference intervals as a reference or inference to what was mentioned. Dr. Gizachao, with 2 minutes, I think they were putting you in a corner just to attend the last comment. We only have 3 minutes to conclude this. Unfortunately, I don't have any questions from the panel, from the audience, except to say, do we get certificate issued, which I will address that later on. Dr. Gizachao, in 2 minutes, your comment on from your experience with regards to ethics.
Yeah, thank you, Chaka. And from my experience, I think most of the countries, I can say that, including Ethiopia, for example, do have the policy and guideline documents. The Ethiopian Medical Laboratory Association has really customized these policy documents, and I think the challenges are well known between the do's and the don'ts that we have been even in the school, we remember. So from the evolution of the ethics, simply the early example of the medical ethics is Hippocrates Oath. So I wanted to really mention that. And the other one is the common rule is most of the African countries really lack in incorporating this common rule that has been raised by a professor from the US. And I wanted to really make this distinction because most of the African countries do not have such really a commensurate budget for lab and even healthcare, even though there is a declaration, the Abuja declaration, that's 50% of the GDP should be towards to the healthcare. But most of the countries are not just making that, let alone a separate budget for the lab. My concern is, do we have an ethics, or we need to say really ethics in resource limited settings? This must be really discussed in the future. And very recently, there are ethics of the free market. So laboratory is just involved in generating an income for both the public and the private labs in institutions, so that we need to have a concern in dealing with such a component. So from human nature to just human rights. So a lot of laboratories do have really working on substandardized, expressly produced, and less quality diagnostic material, including that of the genetic testing, so that the ethics should be really, the ethics from the free market perspective need to be discussed in the future. And I thank you really for this involvement.
Thanks, Dr. Gizachao. thanks from my side. And I wanted Dr. Machingura to conclude and then to have this closure within a few seconds. However, I will have also to recognize amongst us Vinita Gag, who has been helping us out on the administrative part to say, where will you get the informations if you need new updates on what will be happening or the developments with our webinars. You can go on either LinkedIn, the Twitter, the Instagram, and also this presentation is on our Facebook. So thanks, Dr. Prof. Maingano, Prof. Zobo, as well as Prof. Erasmus, whom I understand, and all of us bear with you that you couldn't be with us fully since you have other engagement. However, we had a jinx of what is required here in simplest term, what ethics are, why ethics in our profession, and who is required to be ethical at all times in lab medicine. Those are the few things which all of us who are attending need to address or to look at when we are looking at the concept which we are addressing. Dr. Machingura, you can conclude, and thanks once more all of you who have participated, including the panelists. Thank you.
Thank you very much, Chaka, for handling the session so well. And thank you to the presenter, Dr. Zobo, and all the panelists who were with us, Giza Chow, Bettina, and Prof. Erasmus in absentia, and all of you for attending this webinar. And it's one of the issues that we always grapple with, to say, do we keep talking about one discipline or move on to the next? And really, from this discussion, it's shown that we really need to continue talking on some of these pertinent topics, such as ethics. They are essential as we practice in lab medicine, and we can only learn from one another and keep on reminding each other the important aspects that we need to attend to. And I would want to say, it gives me hope when I see that we have an audience from such a wide range of countries in Africa, meaning that we are able to learn from one another all across the African continent, which is the wish or the desire of the African Consortium on Lab System Strengthening, that we learn from one another. And we also have an input even from the diaspora, which we had today. And we would want to thank you all for paying attention and taking your time to listen, and to advise you that this webinar and others, as Chaka has indicated, is available online on the Empower School of Public Health website. And we will continue to have webinars under the auspices of the African Consortium on Lab System Strengthening. Please keep watch on them. And of note, on the 19th of April, we will have a webinar to celebrate the Medical Laboratory Professionals Week on medical laboratory profession now and the future. Please keep watch for the advert and the registration details. Otherwise, on behalf of the African Consortium on Lab System Strengthening, which is the University of Zimbabwe Department of Laboratory Diagnostic and Investigative Sciences, Cape Peninsula University of Technology, Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Pretoria Department of Chemical Pathology, African Federation of Clinical Chemistry and Laboratory Medicine, and Empower School of Health. I would want to thank you all, and also thank the Empower team who have been the team behind the scenes. Thank you very much. And also, you get a link to get your certificate So you all get the certificate of attendance, which will indicate this webinar so that you can get your CPD points. Otherwise, thank you very much. We will share with you the PDF form of the presentation as well. Thank you. Let's have a good day. Thank you. Thank you.
Thanks very much.
Thank you, everyone.